Hey, this is John Schoen from Schoen Safety and Training, and today I wanted to talk to you a little bit about severe allergic reactions and Epipens. You see, I have a handful of things to talk about today. There are 4 types of readily available trainers on the market right now for epinephrine, which is a drug that's used for people with severe allergic reactions. So first, when is an allergic reaction severe? Does the person have trouble breathing is probably the #1 sign. Is there swelling in the throat? Is there swelling way beyond what is normal? Is there lots of slobbering, lots of saliva coming out of the person? Those are some signs that there may be a severe allergic reaction. So if a person is having a severe allergic reaction, or they've come in contact with the allergen that they know could cause a severe allergic reaction, which we call anaphylaxis, and they have their Epipen, get their Epipen and use it. So now I'm going to take a few minutes, seconds, and show you how to use Epipens. We're going to start with the most common one. This one is the original Epipen. So it's pretty easy to use. You hold it in your fist like this. For all the Epipens, I'm going to say keep your fingers off the top and the bottom. That way you can't screw it up. I've got a little rhyme for this one. Blue to the sky, orange to the thigh. You put it in the outside of the thigh. If you're doing this on someone else, especially a small child, hold the thigh firmly. You want to push hard till you hear a click and count to 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Now this one has a needle cover that will come out and block the needle, so it's important that you hold it firmly in the leg once you hear that click. Because if you let go, this needle is going to be blocked and it's going to squirt the medicine all over the floor. So that is an Epipen. You dispose of it in a bottle or the case that you have, and it goes with them to the hospital. This one is a generic. It's called an Adrena click. Once again, I tell people to hold it in the fist like this. Keep your fingers off the top and the bottom. This one has 2 little signs that say pull. So pull the needle cover off, pull the safety off. The red part goes in the leg. Push till you hear a click. You're going to push kind of hard. Count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now this one is pretty cool. This one talks to you. It's called an Auvi-Q. You just pull the top out and listen to it.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard. Place black end against outer thigh. Then push firmly until you hear a click and hiss sound. And 2, 1. Training complete.
So once again, it's called an Auvi-Q. Now this is a newer Epipen from Teva, which a lot of people are getting now. It's got kind of one extra step, which is a little bit freaky to me because I kind of like the 3-step rule. First, you pull off the gray cover. It's right there. You just pull it off. You might have to twist to pull it off. Now, hold it in your fist. Same rhyme. Blue to the sky, orange to the thigh. Push till you hear a click. Count to 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. That's how you use Epipens. For more information, visit www.schoensafety.com. And if you like this video, click the like button, hit subscribe for more life-saving videos from Schoen Safety and Training. Have a great day.